Odorless garlic has been used to support blood vessel health and manage high blood pressure. It is important to consult with your doctor if you have heart or blood vessel disease, or high blood pressure before using this supplement. Some herbal/dietary products may contain harmful impurities, so it's crucial to check with your pharmacist about the specific brand you are using. It's also important to note that the FDA has not reviewed this product for safety or effectiveness, so it's best to consult with your doctor or pharmacist for more details on the use of odorless garlic. The recommended daily dosage varies, but it is generally safe to take 600 to 1,200 milligrams of odorless garlic per day. It is best to take odorless garlic with food to minimize any potential stomach discomfort. As always, it's important to consult with a healthcare professional before starting any new supplement regimen. To use odorless garlic, simply take it by mouth as directed. Make sure to follow the directions on the product package. If you have any questions or concerns, it's best to consult with your doctor or pharmacist. If your condition persists or worsens, or if you suspect a serious medical issue, seek medical assistance immediately. Remember, it's always important to prioritize your health and well-being. Some common side effects of odorless garlic may include bad breath and body odor, upset stomach, and heartburn. If any of these effects persist or worsen, it's important to seek medical advice. More serious side effects are rare, but you should contact your doctor immediately if you experience easy or unusual bruising/bleeding, or signs of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's best to consult with your doctor or pharmacist. As for the optimal timing and daily dosage of odorless garlic, it's recommended to take it as directed by your healthcare professional. The benefits of odorless garlic may include supporting heart health, immune function, and overall well-being. Before taking odorless garlic, it's important to talk to your doctor or pharmacist if you have any allergies, especially to garlic or other ingredients in the product. This product may contain inactive ingredients that can cause allergic reactions, so it's best to consult with your healthcare professional for more details. If you have any bleeding or clotting problems, stomach or abdominal issues, or if you are planning to have surgery, it's important to consult with your doctor or pharmacist before using odorless garlic. Garlic may increase the risk of bleeding problems, so it's important to discuss this with your healthcare provider. It's also important to limit alcohol while taking odorless garlic, as it can worsen the risk of stomach upset and bleeding problems. If you are diabetic, have alcohol dependence, or liver disease, it's important to use this product with caution and consult with your doctor or pharmacist for safe use. If you are pregnant or breastfeeding, it's recommended to consult with your doctor before using odorless garlic, as it may not be suitable for use during these times. When taking odorless garlic, it's important to be aware of potential drug interactions. This product may interact with medications such as protease inhibitors, non-nucleoside reverse transcriptase inhibitors, isoniazid, and medications or herbal products that may increase your risk of bleeding. In addition, odorless garlic can speed up or slow down the removal of other medications from your body, which may affect how they work. This includes drugs such as acetaminophen, azole antifungals, chlorzoxazone, and calcium channel blockers. It's also important to note that aspirin may increase the risk of bleeding when used with odorless garlic. If your doctor has prescribed low doses of aspirin for heart attack or stroke prevention, it's important to continue taking it, but consult your doctor or pharmacist for more details. Furthermore, odorless garlic may decrease the effectiveness of hormonal birth control, potentially leading to pregnancy. If you're using hormonal birth control, it's important to discuss with your doctor or pharmacist whether you should use additional reliable birth control methods while using odorless garlic. Additionally, if you experience any new spotting or breakthrough bleeding, it's important to inform your doctor, as it may indicate that your birth control is not working well. If you suspect an overdose and the person is experiencing severe symptoms like loss of consciousness or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center for assistance. Make sure to keep all of your medical and lab appointments to monitor your progress or check for side effects. Your doctor may also recommend certain tests to ensure that odorless garlic is working effectively for you. If you forget to take a dose of odorless garlic, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. Make sure to check the storage information on the package, and if you have any questions, ask your pharmacist. Keep odorless garlic and any other medications or herbal products out of reach of children and pets. Do not flush odorless garlic down the toilet or pour it into a drain unless instructed. Dispose of the product properly when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.